Growing up a family in the shadow of a pandemic. The risks of conceiving and bearing a child during the coronavirus epidemic has become an uncertain future. The coronavirus threat has tormented us in many ways, but it is perhaps one of the deepest. Deciding whether to start or expand a family has suddenly become even more difficult. Pregnant during the pandemic is not the scenario that most people would choose. But waiting to conceive comes with its own risks, especially for older parents. Thousands of families across the United States are facing this problem, and experts are reluctant to offer definitive advice. The American College of Obstetricians and Gynecologists acknowledges that there is no clear answer to the question of whether pregnancy should be delayed. But it lists the various risks families should consider, including potential financial challenges and the health issues that could arise. There is such a dearth of data right now, said Mary Jane Minkin, MD, clinical professor in the Department of Obstetric Gynecology and Reproductive Sciences at Yale Medical School. We still don't know how COVID-19 infections might affect a fetus in the first trimester, or the long-term effects of the virus, and now a mysterious inflammatory disease linked to COVID-19 is affecting a small number of children. Mothers also have reasons to worry about their own health. Pregnant women consult their doctor less frequently, sometimes by telemedicine rather than in person. Some pregnant women with COVID-19 became very ill and were placed on a ventilator, and in many hospitals, working mothers can only bring one support person. Then there are the financial considerations. Hundreds of thousands of people are out of work and the future of the economy is uncertain. Families who are on the fence might consider waiting a year, Dr. Minkin said. But for those who want to get started right away, the good news is that we have no evidence to suggest that COVID poses a higher risk to pregnant women than anyone else, and so far it appears the virus is not transmitted to a baby in the womb or while breastfeeding, she added. Everyone must consider their own values and priorities and make decisions based on them, said Pooja Lakshman, MD, perinatal psychiatrist and assistant clinical professor at the George Washington University School of Medicine, who has counseled patients who have difficulty in understand if they have to wait. Design. It's really important here not to compare yourself to friends or family.